Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Heart Health Awareness. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational workshop programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter your questions into the chat function found at the bottom of the Zoom window at any time. Without further ado, I introduce our workshop speaker. Dr. Priya Mitra started her career in internal medicine and then transitioned to radiation oncology in 2007. She currently works at UCI Medical Center and treats all cancers with a specialized focus in women's cancers. Thank you so much, Dr. Mitra, for joining us today.
Of course, my pleasure. Thank you for having me. All right, let me share my slides. All right, you guys can see my screen, correct?
Yes.
Okay. So today's topic is heart health awareness. As I was introduced, my name is Priya Mitra. Very nice to meet you all, and I appreciate you taking some time aside to join us today. Okay. All right. Thank you all for bearing with me. So a little bit of background, as was already mentioned, I did internal medicine first. During that time, I took care of a lot of patients in the hospital. We took care of heart attacks, strokes, pneumonias, those kinds of things. I subspecialized in radiation oncology and have worked at a few different locations, currently working at UCI. So February was Heart Awareness Month in the US. Every month has a Health Awareness Month. And I know it's not February, but since it was so recent, I thought it was a good opportunity to share some information about heart health awareness. So these are the categories that we're going to go through. Please feel free to stop me if you have questions. Be happy to make sure we answer any questions as we go. So I'll pause periodically, or you can message in the chat. So I want to talk today about statistics, talk about what vital signs are, talk about definitions of heart-related conditions or cardiovascular conditions. We'll touch a little bit on CPR and then talk about how we can have a healthy lifestyle to limit our risk of developing heart disease. So we'll start with statistics. I found some of these numbers to be quite staggering, honestly. So heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups. One person dies every 33 seconds from cardiovascular disease. A few years ago in 2022, over 700,000 people died from heart disease. That's 1 in every 5 deaths. So it definitely is affecting a lot of us in this country and even around the world. Heart disease is also really costly to the health system. So between 2019 and 2020, over the span of 1 year, over $250 billion were spent taking care of heart disease. That includes going to the doctor, going to the hospital, medications, loss of productivity due to death. So I found this map to be really interesting. This is looking at the rates of heart disease between 2018 and 2020, affecting adults above the age of 35. And they did it by county. So the darker the color, the higher the incidence or prevalence of heart disease. So what I found interesting is that it's largely concentrated within the South. And I think that often is linked also with higher increased risk of high blood pressure, high cholesterol, diabetes, obesity. A lot of that is concentrated in the South, and that correlates with heart disease as well. So vital signs. Whenever I see a patient in the clinic or in the hospital, there's 5 major vital signs that we look at. And I'm sure you're familiar with these, and some of the first few I'm just going over for completeness sake. So one is temperature. I think you all know when you check your temperature, normal temperature is about 98.6 degrees Fahrenheit. Respiratory rate is the rate at which we're taking breaths. Normal is about 12 to 20 breaths per minute. When I would take care of patients in the hospital who, for example, had a pneumonia, a lung infection, their respiratory rate would be really high. Or if somebody comes in with chest pain and is in a lot of pain, and is having a heart attack, their respiratory rate can also go up. If somebody is really not doing well, their respiratory rate, excuse me, can go down. So you can have people who have respiratory rates of 20, especially if, excuse me, less than 12, especially if they're um, not doing well, or even like near end of life, the respiratory rate often drops. Oxygen saturation is how well oxygenated our bodies are. Normal is between 95 to 100%. That being said, people who have emphysema or COPD, you may have heard of, they can live in the low 90s, like 92 to 94%. But still, this can be kind of a red flag if the number is in the 80s, that may be a sign. So anytime somebody comes into the emergency room, for example, with chest pain, we're going to check all these vital signs. And if the oxygen levels are low, that's also a worrisome sign. So the most important ones pertaining to heart health awareness are the pulse and blood pressure. So pulse normal range is between 60 and 100. I don't know if any of you know how to check your pulse, but if you check, you can check it in a few different ways. One is, I don't know if you can see me, but if you hold your fingers just under your jawbone on the side of your neck, you can feel the pulse. You can feel the pulsation of the blood vessel as blood is being pumped around our body, and that's a good spot to check. Another spot is the wrist. So right at the base of the thumb, you can feel your pulse there. And you can count, set a timer for 60 seconds and count what the rate is. So again, between 60 and 100 is normal. Now, in people who are marathon runners, for example, their baseline heart rate can be in the 40s, sometimes even a little bit lower, but oftentimes they're in the 40s. And the reason for that is that the heart is essentially a muscle, right? So it's pumping. And if somebody does a lot of cardio exercise, the efficiency of the pump gets better. It improves. So the heart doesn't have to pump as much, which is why people's heart rates who are active, cardiovascularly active, their normal pulse can be low. The best time to check your pulse is first thing in the morning when you wake up before you get out of bed. You can check your pulse and get a sense of where you are. And it can be a nice measure of your cardiovascular fitness. I remember my heart rate or pulse used to live in the 60s to 70s. And as I started doing more cardio exercise, my resting baseline heart rate is now in the 50s. So it's not necessarily a cause for concern, but it is helpful to, I think, be aware, especially if you're starting a cardiovascular program and trying to get more fit, monitor your heart rate. Blood pressure. So normal blood pressure is less than 120 over 80. So the top number is called the systolic, the bottom number is called diastolic. I found this table to be helpful. It's different categories of hypertension. Hypertension is just our medical terminology, as you probably may already be aware, of elevated blood pressure. So normal is less than 120 on the top number or systolic and less than 80 for the diastolic. It's considered elevated if it's in the 120s, above 120, so 120 to 129, and your lower number is still less than 80. Stage 1 hypertension is when you start rising into the 130s, and your lower number starts to go up into the 80s. And then as you can see, the hypertension stage 2 is there, 140 or higher or 90 or higher. And hypertensive crisis is higher than 180 and higher than 120. There's also hypertensive emergency, and we would see a lot of patients in the emergency room with that, where it would be 220 over 120 or higher, and that can be very dangerous because that can really increase the risk of heart attacks or strokes, and we're going to talk about that. Any questions so far? If not, I will keep going.
None so far, thank you.
Okay, thank you. So definition. I briefly mentioned just now heart attack and stroke. And you've also may have heard of cardiac arrest. I think sometimes these phrases and terminology can be used interchangeably, but there are important distinctions. So I wanted to go through them. So a heart attack is it's a circulation problem. As I mentioned, the heart gets oxygen from the lungs, and its job is to pump. It pumps oxygenated blood through the rest of the body to make sure that it has oxygen or fuel for the body to keep working. One of the things that the heart does is it not only does it pump oxygen to the rest of the body, it also pumps oxygen to itself so that the heart gets nourishment from that oxygen to do its job. Now, the problem is if those blood vessels that the heart is using to supply itself get blocked, whether it's with calcium buildup or cholesterol buildup, that is a heart attack. Basically, it's not getting enough oxygen or blood supply, and that can trigger chest pain, and that is a heart attack. Cardiac arrest is something very different. I don't know if any of you have ever been out just in normal life, whether you're at an airport or whether you're on a plane or at school or in a church or at a mall and somebody collapses. Sure, that could be a heart attack, but it could also be cardiac arrest. So in that situation, the first thing that we typically will do is check for a pulse. This actually happened to me one time I was on a plane and a woman literally passed out right next to me in the aisle. And so the first thing we did is we checked for a pulse. We checked her neck, we checked her wrist, and we checked her groin, which is basically where the thighs meet the pelvis, that line. And so we checked and she didn't have a pulse. So then we think that's what makes us think, okay, that means that the heart's just not working. And so there's probably an electrical problem. And so AED is something that we would then apply to the chest to check for a rhythm. Is the heart electrically functioning or not? Stroke is kind of like a heart attack, but for the brain. Basically, the brain is not getting enough oxygen, and that can happen in two ways. Either there's a blood clot that's blocking it, or because of high blood pressure, one of the blood vessels in the brain can burst and you can have a bleed. So that is what a stroke is. So let's talk about signs and symptoms of heart attack versus stroke. So on the left are warning signs of a heart attack. Now, to be clear, you don't have to have all of these signs. These are just possible signs. So systemic, meaning full body symptoms that sometimes people can have is inability to sleep, breaking out into a cold sweat out of the blue, feeling discomfort in your upper body. So it doesn't have to be just chest. It could be shoulder. It could be your left arm. It could be your jaw, your neck. Skin, you start to feel very pale and clammy. Stomach, sometimes people can get nauseated, and that can be the sign of a heart attack, or abdominal pain. Now, that doesn't mean that if you have nausea that you're having a heart attack. But if something doesn't feel right and you feel like you're having nausea that's getting worse and it's unprompted, it's something to really pay attention to and not to ignore. Sometimes people can get dizziness or lightheadedness. Shortness of breath is a very common symptom. Patients, so the classic description is crushing left-sided chest pain, feels like an elephant is sitting on your chest. You can't catch your breath. Your ability to do normal activities is impacted. For example, I had I had an uncle. He was at home just one evening and he was overweight and had other risk factors, high blood pressure, diabetes, high cholesterol. And one night he went up one flight of stairs at home and he noticed when he got to the top of the stairs, he just didn't feel right. He didn't have any chest pain, but he just felt really winded. And this is kind of going to that unusual fatigue, felt really, really weak, laid down in bed, and just something didn't feel right. And thankfully, they called 911 and he was having a heart attack. And so thankfully, it was recognized early. So stroke is very different. There's a nice mnemonic called FAST, which you can use to remember. And again, you don't have to have all of these signs, but if you have any of these, the first three, that's something to not ignore and to call 911. With stroke, early detection is the key. If the stroke is being caused by a clot, if you catch it early, within the first 2 to 3 hours, you can give a blood thinner that can reverse the symptoms sometimes completely. So early detection is the key. So what are the signs? Face. If you have droopiness or if you notice a loved one that has droopiness of one side of the face, that could be a sign of a stroke, especially if it's just sudden out of the blue. There's also a thing called Bell's palsy, which you may have heard of, which is not a stroke. But so it's just because one side is drooping doesn't mean it's a stroke, but it's something that does warrant further attention quickly because you want to make sure it's not a stroke. Arms, and really legs apply to this too. Are you able to raise both arms? I had a patient who was shopping and she told me that she was shopping and all of a sudden she noticed that her right leg was dragging behind her. She wasn't walking normally and it just came out of the blue and she wasn't sure. It's not like her leg was asleep, but she had sudden onset weakness of one leg. Thankfully, she called 911, went to the hospital, went to the emergency room. They scanned her brain and found out that she was having a stroke. Slurred speech. I've had this happen to a patient. I've had a patient who was in the waiting room and I was talking to him and he all of a sudden had garbled speech, and the wife brought it to our attention. She said, something's not right. He seems confused. His speech is not the normal way that he normally speaks. He seems off. We got into the emergency room, turned out he was having a stroke. The key is, ideally, as I mentioned, call 911 fast. That is the thing to remember. Better to call than not call. The other thing I wanted to highlight is that men and women can have different symptoms. As I was just describing to you just a bit ago, the crushing left-sided chest pain, fatigue, shortness of breath, jaw pain, especially on the left side, um, is very classic symptoms, but that's what typically happens to men. Women don't always have all those symptoms. So it's really important. I mean, a nurse that I work with, same thing. She was starting to have unusual fatigue. She had baseline high blood pressure, and thankfully it wasn't severe enough that she needed to go to the emergency room, but she brought it to the attention of her doctor and they ordered a stress test. So a stress test is a way that you can get the function of your heart checked. Basically, it puts the heart under stress through exercise or medication, and it checks to see how efficient your heart is and if there's any blockages that they should be concerned about. But I just wanted to make sure everybody is aware that women can have different symptoms than men, and not to ignore something that's not your baseline. Any questions before we move on to CPR?
If you have any questions, feel free to unmute yourself or put it into the chat. But there are no questions as of yet.
Great. I will keep moving. So CPR. So how is CPR performed? There's two different types of CPR that you can do. What we are trained to do as a healthcare provider is a combination of chest compressions and mouth-to-mouth breathing. The ratio that we are taught to do is 30 compressions on the chest. And the best way, I don't know if you can really see me, but basically you put the palm of your hand on the breastbone or sternum, on the lower part, and you push as deep and hard as you can. Ideally to a depth of about 2 inches or 5 centimeters. The rate at which you should be compressing is 100 to 120 times per minute. It's actually pretty tiring, honestly, to do it for that period of time. But that is the rate at which you're supposed to do it. I was taught there's a song, the Staying Alive song, and that's the rate at which you're supposed to press. Staying alive, staying alive. And so some people that I remember my last trainers, they sing that song in their head just to kind of keep themselves in check as to how quickly you're supposed to be doing it. So 30 compressions followed by 2 compression breaths. A lot of people understandably are hesitant to do the breath, the mouth to mouth. And the recommendation for the general public or bystanders, especially if you're not a healthcare provider and not trained in CPR, all you need to do is compressions. That's it. That can save lives by itself. So if you're at a zoo or in a park or just in a public place and somebody collapses, I would encourage you to, if you feel comfortable, just encourage people to start doing chest compressions. And number one, though, before doing that, is call 911, call for help so that they can be checked. So again, 2 steps, call 911 and just push hard and fast on the breastbone and wait for your help to arrive. That's really all you need to do. You don't have to worry about mouth to mouth, but hands-on CPR, hands only, it really is that simple. And this just minimize interruptions and chest compressions. As I mentioned, it is tiring. So if you are there with someone else, switch off. Say, okay, I'm going to switch. I'm getting tired. I want you to take over for me and take turns. You want to keep applying the compressions at an adequate rate, as we talked about, 100 and 120 times per minute if you can. You want to avoid leaning on the patient. You want to make sure your hands are in the right spot, and you don't have to worry about ventilation. All right, healthy lifestyle. So the American Heart Association has introduced Life's Essential 8. I thought this was a really nice summary slide of what we can do, what we have in our power to control and limit our risk of developing heart disease, whether it's heart attacks or strokes. So number one is to eat a healthy diet consistent with the American Heart Association recommendations. Their website is actually a great resource, and I would encourage you to check it out if you are interested in this. So one of the things that they talk about is to eat a plant-based diet that has been shown to be associated with longevity. Doesn't mean you can't eat meat, but the recommendation is to try and eat a more plant-based diet, less meat and more plants if you can. The other piece of advice that is often shared is to eat the rainbow, meaning every day, if you can, try and eat something that's natural, not out of a box, that is one color of of the rainbow. For example, red peppers, oranges, bananas, spinach, blueberries, blackberries, eggplant. Um, those kinds of things can be really, it's I think most efficient if you can get one bowl, one meal, throw in like a big salad or make a bowl of some sort and really try and get your fruits and vegetables in. Add some hummus, add some beans, add some legumes. Those kinds of things can add protein, especially if you're trying to do more of a plant-based diet. Getting in at least 150 minutes of moderate intense physical activity or 75 minutes of vigorous intense activity a week. I remember when I first saw that, it sounded pretty daunting and overwhelming. Like, how am I going to do that? But if you think about the 150 minutes of moderate intense physical activity, that could be a light jog. I mean, that's really about 30 minutes a day for 5 days. Even speed walking. I mean, it doesn't have to be, you don't have to be, running a marathon. You don't have to be running miles and miles, but just being active, even in your home, going up and down the stairs, jumping jacks, doing aerobics, water aerobics. Uh, just being active is going to help. And it kind of ties back to the vitals that we were talking about. Normal heart rate, as I mentioned, was 60 to 100. And pay attention to that. If you're trying to get healthier, check your heart rate and see if you notice a trend towards getting a little bit more efficient and a lower heart rate. Avoiding tobacco is really, really important too, because that can increase the risk of us developing heart disease. So, to not smoke and or vape or use any other kind of tobacco products is really strongly advised. Getting enough sleep is really important as well. I think we all have times where we get enough sleep, and there may be maybe more times than not that we don't get enough sleep. But it is helpful to do our best to try and aim for 7 to 9 hours of sleep a day, if at all possible. Maintaining a healthy body weight is really important as well. So I don't know if you're familiar with body mass index or BMI. You can look online, there are BMI calculators. So basically what you do is you put in I believe you put in your gender, you put in your height, and you put in your weight. And it's not a perfect calculator, but it gives you an idea and it gives you a range. So I believe it's roughly 18 and a half to 25 is the normal range. So there is a normal range. It's not like if you're 5'5", you have to be 125 pounds. It doesn't work like that. There's a range of normal, a range of healthy body weight. So I'd encourage you, if you haven't already done that, to do your BMI and calculate it. The 25 to 30 is the overweight range. 30 and above is considered obese. Below 18 and a half is considered underweight. So, calculate that. I remember when I first did it, I was surprised. I didn't think I was overweight, but I technically was in the overweight category. And it was a bit of a push for me to try and get healthier. Getting your cholesterol checked. We recommend that you get your cholesterol checked once a year. A lot of times people, I think myself included initially, I used to think, okay, if my BMI is healthy and I don't have high blood pressure or diabetes, why would I need to get my cholesterol checked? The reason is that you can have high cholesterol and have a normal weight. Sometimes I've seen the healthiest of people have high cholesterol. And one of the reasons for that is that it can be hereditary. A good friend of mine is, when she was in her 30s, was diagnosed with sky high cholesterol. And she ate healthy and was very fit, but she's had to go on medication because it runs in her family and her cholesterol was high, and that can help decrease the risk of developing heart disease or stroke in the future. Um, if you are diabetic, you want to make sure we try and keep your blood sugars under control. I've seen many patients do this where they reverse their diabetes. Obviously, it depends on the type of diabetes that you have. But if it's type 2 diabetes, a lot of times that can be linked to your weight and diet. And through lifestyle changes, you can improve that and go off of medications. Hemoglobin A1C is a blood test that you can have your primary care doctor check, or whoever does your blood work for you. And that's a nice screening tool sometimes that we use to see if somebody's borderline diabetic or has diabetes. And then, of course, monitoring your blood pressure. There is a phenomenon called white coat hypertension. Not sure if you guys are familiar with that, but basically it's very common. I had a patient today who told me that she has it. Basically, when people come into the doctor's office, they often get nervous. and that can increase their blood pressure. And so if you were told when you went to your doctor's office that your blood pressure was a little high, I would encourage you to go to either buy a blood pressure cuff to use at home or at a local stores like Walmart, Target, Walgreens, CVS. A lot of them have blood pressure cuffs that you can check when you're in a natural environment and you're not nervous or stressed or not around, the medical setting. Sometimes that can be really helpful. So in summary, I hope that you walk away from today knowing and recognizing how serious a health condition heart disease can be. It affects people all around the world. I hope you've learned a little bit about the signs and symptoms of heart disease, including heart attacks as well as stroke. With CPR, just a reminder, you can save a life just by doing chest compressions. You don't have to worry about mouth to mouth. And if you don't feel comfortable, that's perfectly fine, but just call 911 or make sure someone's calling 911. The faster we take care and address these patients, the more likely they are to survive that event. And that hopefully you have learned some healthy habits that you can incorporate into your day-to-day to help minimize the risk of these conditions. And I want to say thank you for your time and your attention. And open for questions.
Thank you, Dr. Mitra. Can you go back to the slide we're talking about? I think it's heart disease or the different symptoms between men and women. If you can highlight just a little bit more about what the differences for women could be.
Yeah, I mean, I think the biggest thing is that I think when we talk about symptoms of a heart attack, the classic symptom is left-sided chest pain, crushing left-sided chest pain. And a lot of women don't get that. So I've had patients who feel like they're getting heartburn and like a burning in their chest that's going to their back, right? I mean, something like that. If you have heartburn at baseline, that's fine, right? But if it's something unusual, something you've never felt before, and it's severe, right? That's something you don't want to ignore. So, like if we look at what's listed here, you may not get chest pain.
I can't see your screen. I just see gray.
Oh, don't know why. Let's see.
You may need to press escape. Oh, there. Okay. Because I think it went to the end of the slideshow.
Can you see it now? It's saying
loading.
my screen sharing is paused.
Thank you. Oh, if you can switch the display.
Okay, one sec. Is that any better?
Let me.
About it. And I appreciate, Pam, thank you for your comments. She said that she had a heart attack last month, felt like I couldn't fill my lungs up and both of my shoulders hurt. I mean, I appreciate you sharing that. That's a great example of, it doesn't sound like she had chest pain, right? So I think we all know our bodies. We all know when things are feeling normal, when they're not feeling normal. So I think the takeaway is to really just pay attention. So if you get pain and you didn't do anything and like she said, her shoulders were hurting and she feels like she can't fill her lungs up with air, that's something to take seriously. We may not think that it's a heart attack, but we just, as we all get older, it's important to pay attention and seek medical care. And if you're not sure, call your doctor, right? You don't have to go to the emergency room. You don't have to call 911, but at least call someone, right? Maybe even call a family member, call a friend, say, can you come over? Can you check my vital signs? That's also why, if you are at risk for having heart disease, it's probably a good idea to have a blood pressure cuff at home. They're not too expensive. I think they're like $15, $10, $15. You can get some. And especially if you're feeling like this, check your blood pressure. If it's sky high, if it's 200 over 100, that may be a sign, okay, that something's not right. Or my heart rate is 120 and it's supposed to be between 60 and 100 and it's 120 and I don't feel like this. Or if your oxygen level is low, you can get a pulse oximeter. I don't think you need to have a pulse oximeter, truthfully, unless you have lung issues. But some people like to have it, and you can get one that basically you put it on your finger and it will tell you your oxygen level and your heart rate. So that's something. Or if you don't want one of those, you can even, as I was trying to demonstrate earlier, you can check your pulse yourself. That's why I wanted to talk about vital signs, because these are things that you can do at home as a way to kind of screen yourself. And Pam commented, yeah, her blood pressure was sky high, 214 over 135. So, honestly, kudos to you for not ignoring your symptoms and getting checked and seeking medical attention. And it sounds like you're doing well. Um, but we also don't want to wait for us to have symptoms, right? Which is why I was trying to emphasize the importance of con following through on the things that we can control, right? Get your blood pressure checked. Check it yourself. Go get it checked at the doctor's office. If your blood pressure is high, if you are on medication, great, that may help. You may benefit from being on an aspirin or a baby aspirin. Talk to your healthcare providers about that. Cholesterol medication also can save lives, right? I mean, if you have elevated cholesterol and you get on a statin, for example, that can really help limit the amount of plaque buildup in your blood vessels, in the brain, in the heart, all over. So really, monitoring your weight too. It all ties together. And so, and if you don't want to be on a statin, if you don't want to be on medication, start exercising a little bit more, right? I mean, these are things that can help lower your blood pressure. If you feel like your blood pressure is elevated because of stress reduction, right? Whatever that is for you, whether it's meditation, whether it's yoga, whether it's just spending time outside, whether it's just taking a few breaths on your own, um, finding ways to laugh. I mean, watching comedy shows, watching comedy stuff on YouTube. There's a lot of things that we can do to help mitigate these risks. So, I think a lot is in our control. A lot is not in our control, which is why we get checked. But if you're concerned, ask your doctor, would I be eligible for a stress test? Do I have risk factors that would qualify me for a stress test? And then you can really get a sense of how healthy your heart is. Another thing just to mention, there's a thing called a calcium score. So I don't know if you are familiar with that or if any of you have heard of it, but my parents got it done recently, and my stepdad's score was sky high. And fast forward, long story short, he ended up needing bypass surgery, and he was completely symptom free. Plays tennis 3 times a week, zero symptoms, but his calcium test came back abnormal, which led to further testing, including a stress test, and he was found to have blockages. So, being an advocate for yourself, I think is also really helpful. You guys are all as part of the cancer support community. I hope that your cancer is in check. And as you're living longer, healthier lives, we want to make sure that your heart is in check too and taken care of.
Yes, wonderful. Thank you so much, Dr. Mitra. Are there any other questions?
The cardiac, so Pam mentioned that she had a test of 498. So that's interesting. So that is considered a high score. So it's not surprising that she had heart disease. So yeah, look into it. And the calcium test, if you just Google, I don't remember honestly what exactly it's called, but it's the calcium heart test. If you Google it, you should be able to find it. And my parents got it done for free. A lot of places are doing studies where you can go get it for free. It's a free screening test and nothing out of pocket. And it's just more information so that you can figure out if your score is high, maybe you should go get further testing done.
Is it called the CAC scan, coronary artery calcium scan?
That sounds right.
Okay. So
Thank you
maybe
for looking that up.
yeah, absolutely. Thank you for sharing about that, and thank you, Pam, for sharing as well. Last call on question. Thank you so much, Dr. Mitra, for your time and sharing this information. It really impact any of us, cancer related or not. It's really important to know, especially the part where you talked about that we can control, things that we can adjust, things that we can do to just prevent or help even mitigate some of the risk involved.
Exactly.
Thank you again.
I treat a lot of breast cancer patients and women who have left-sided breast cancers. When we give them radiation, their heart has a higher risk of having, effects, right? Because of the radiation is going very close to the heart. And sometimes part of the heart does get exposed to radiation. So I tell my patients, what we've talked about today, make sure your blood pressure is in control, make sure you get your cholesterol checked, monitor your weight, get healthy, get that heart rate, in the lower range of normal of the 60 to 100, maybe even enter into the 50s. Little changes honestly make a big difference. So if you can't commit to 150 minutes of exercise, moderate exercise, that's fine. Start with 30 minutes. Start with once a week. Next, maybe a month later, you start doing twice a week and just build gradually. You don't have to hit those milestones or those recommendations from the time you start, but I would just encourage you to start somewhere. Even as I mentioned, when I found out my BMI was elevated, it's just little changes. I didn't drop weight suddenly. Little changes, swapping out dressing for hummus, cutting out late night snacking, little things, monitoring the quantity of food. And these little changes, honestly, I guarantee you it will add up if you stick with them and you'll be healthier in the long run.
Sound advice. Thank you so much. Thank you again for your time and presentation. Very important.
Well, thank you for the